Great. So welcome everyone, and this is the fourth webinar that's happening. We have with us Dr. Michelle. She's a brilliant veterinarian and always phone a friend to me. I constantly call her up or message her, I need this help. And she's always like, okay, do this, do that. Why don't you try this? This is the best option. You can go ahead with it. And she's even helped a lot of our community members of Pets of Paradise. So thank you, doctor, for being there constantly for us and actually being a phone a friend for us. We also have Vinda with us, who runs her brand called Curious Cat Company. And I think I'll give it to Vinda because she and Michelle go a long way back.
So I was introduced to Dr. Michelle probably 3.5, 4 years ago when I first started Curious Cat Company, which is a little tiny brand for cats and cat people. And she was the most supportive person ever whenever it came to doing any kind of activity or answering questions in our newsletters and doing these educational seminars, even when we were like a very tiny little page with 100 or 200 followers. And she has seen me all the way through, and she's become a very good friend. She also happens to be one of the very, very few vets who have expertise in cats. And we all know how rare that is. So we're very excited and happy that she's here to answer questions. We have a lot of questions. And if any of you attending this session have any other questions to ask, please type them in the chat, and Darshan and I will take them up as they come. So thanks, Dr. Michelle. Can we start asking you questions?
Yes, sure.
Okay. So the first one is, what is the basic first aid kit that any cat parent should have at home?
Okay, so the first thing that you're going to need to have in your first aid kit is disposable gloves, just because if there's a wound or something like that, it's just easier to clean and better to handle your cat with gloves on. Another thing that you're going to need is clippers, like those tiny shaving machines that you get. That's a really good thing to have in your first aid kit, because with cats, if it's an abscess or if it's a wound, it's tougher to cut the fur with scissors. So it's easier to just shave off a little bit of fur with the clippers. You can get them on Amazon or on any other website. And that's just good to always have around. And another thing that you can do is when your cat is younger, you can just get them used to having the shaving machine, or maybe shave like a tiny bit on their paw or something like that, just so that they get used to the sound. The most common thing that you'll need first aid for is a wound. So you have to have something called a styptic. A styptic is basically something that stops bleeding. So you get this one styptic called botroclot, which you should be able to get from any chemist that sells veterinary drugs. And if you can't get botroclot, then from a regular chemist, you can get potassium permanganate powder. So that also, the crystals, you just have to put like a couple of crystals on the wound, and that stops the bleeding immediately. Another thing that's important as an antiseptic is betadine. So betadine, the lotion, the liquid that you get, that's something that you must always have in your first aid kit. Savlon as well, that's chlorhexidine. That's good for just like wiping a wound or cleaning up something before you put an ointment on it. Okay, so betadine and Savlon are your two antiseptics that you keep there. You need to have gauze rolls and gauze squares. And you also get something called wet wrap, which you can get online, which is basically a kind of bandage that just sticks to itself. If your animal's ever been to a clinic for an IV, you'll see they cover the IV line with like a colorful tape. That's what wet wrap is. So that's also available on Amazon. As for medication, one thing that's good to always keep for cats is something for fever and pain. So there's something that Himalaya makes called Himpirin. So Himpirin is always something that you should keep in your first aid kit. It's just 1 ml for an adult cat and 0.5 ml for a kitten. Because as you know, crocin is toxic for them, paracetamol is toxic. So Himpirin is a good substitute that you can give that's completely safe. And even if they have other issues like kidney issues or anything else, Himpirin won't hamper that at all. Gabapentin. So Gabapentin 100 milligram tablet, 1 strip is something to always keep in your first aid kit. You can give them half a tablet if they're an adult cat. This just calms them down and sedates them a little bit. And it's a good painkiller as well. So if there's no fever and there's just pain, then it's better to give gabapentin instead of Himpirin. And
Can you
for
spell that gabapentin?
GABAPIN.
PABA?
GAP GABA, GABAPIN, gabapentin.
Okay. Okay, it's because I'm typing all this in the chat so people can
Okay.
access it. Yeah.
Okay. So gabapentin 100 milligrams. For a smaller cat, it will be a quarter tablet, but for a larger cat, half a tablet. This is also good if you have a fractious or a nervous cat and you want to take them to the vet. Then vets around the world will advise you to give half a gabapentin before taking them into the clinic. So it's not just a painkiller; it just also calms them down. Another thing to have in your first aid kit is Ondem syrup, ONDEM. That's an anti-emetic or anti-vomiting syrup. So you should always call your vet first before giving it to them. But again, it's safe to give 1 ml to an adult cat and half an ml to a smaller cat. You can go up to 2 ml for a larger cat. And a flagyl syrup. Flagyl is for diarrhea. It's an antibiotic and an anti-inflammatory, but it's always just good to keep this in your first aid kit, because if you suddenly find your cat having like explosive diarrhea in the middle of the night and you can't reach out to your vet, at least you can give them 1 dose safely before you take them anywhere. So
that's flagyl.
FLAGYL. Yeah. Okay. Another thing that happens to cats very often is they get stung by insects or bees, or they may have a vaccine reaction sometimes. So you need an antihistamine in your first aid kit. And Cedzine is a good over-the-counter syrup to keep in your first aid kit.
Cats
Cedzine.
love Cedzine that even we take. Same one.
Yes, yes. But the syrup, we normally take the tablets.
Okay.
So again, it's safe to give 1 ml. For a larger cat, 2 ml. It's normally half of the body weight. So for a 4 kg cat, they can take 2 ml. Think of it like that. For a small cat, like a 1 kg cat, then half an ml. Okay. And another thing to keep in your first aid kit, you don't use this until you talk to a vet over the phone, but one steroid is always good to keep in case of a bad allergic reaction, or like, God forbid, like a snake bite, or, if they've had like a bad reaction to a vaccine or to a certain drug, or if they've licked something and you suddenly see their whole face all swollen up and, their eyes puffy. And if Cedzine is not working, then omnacortil syrup is another thing that you should keep.
Cannot spell that.
OMNACORTIL.
I think after this lecture, doctor, I'm going to request you to write down these things and send it to us.
Sure.
Okay.
Okay, I think
Is that it?
that's it for the basic first aid kit. I mentioned
just
balls and bags.
check the chat, guys. I've written the list as to my best.
I'll just read it out once. Clipper, gauze, small trimmer, betadine, Savlon, Himprin,
Hempirin.
GABA pill tablets, Ondem consult a vet, flagyl syrup, Cedzine syrup, 1 steroid for allergy, consult your vet, and
Omnacortil.
Omnacortil is the steroid.
Yeah. Can you, if there's I missed out or anything, please just add Dr. Michelle, because that was such a long list of complicated spelling. Guys, you can access the chat. Okay. Thanks, Monish. You are better at this than I am. Would you like to host?
Okay, I think I'll ask the next main question of the day was that what is the vaccine schedule for the cats?
So starting with kittens, you start your kittens vaccines from the time they're 6 to 9 weeks of age. So you first give them 1 round of deworming. And then you start with your tricat vaccine. So your tricat vaccine covers 3 viruses. That's Calici, rhinotracheitis, and Panleukopenia. So you'll give 1 tricat vaccine. That's the primary vaccine. 3 weeks later, you'll give the booster. That's another tricat vaccine. And 3 weeks after this, you'll give the rabies vaccine. So in their first year, they'll be getting 3 shots. So this will be boosted when they are 1 year and 3 months of age. So 1 year after the last vaccine, basically. Then you'll booster all of this again 1 year from the previous one. So they'll get that when they're 6 weeks, 9 weeks, and 12 weeks. Then when they are 1 year and 3 months of age, and then when they are 2 years and 3 months of age. After they cross this 2 years mark, it's recommended by the WSAVA and by vets around the world that you only give the tricat and rabies every 3 years to cats. So you give it when they're 2 years and 3 months, then when they're 5 years and 3 months, then when they're 8 years and 3 months, and then if they need it when they're 11 months. However, if your cat is an indoor-outdoor cat, then you will have to do this every year. You give the tricat and the rabies every year. Also, if you are a feeder or if you interact with a lot of strays and you're not really sanitizing properly when you come home before you meet your cats, then also it makes sense to give it every year. Otherwise, once in 3 years is enough once they cross 2.5 years.
Okay. All right. So you mentioned that cuts and bleeding is a very common thing that happens to cats and kittens. So how can you stop a cut from bleeding? What can you do as the first aid approach?
So the main thing is to apply pressure. So you have to see how much it's bleeding first of all. So if it's like a really tiny cut, like on the paw or something like that, you can just use some gauze with betadine and hold it on the wound till it stops bleeding. If it is a larger wound and it's like dripping blood, like sometimes from an ear tip or something like that, then you can take a little bit of potassium permanganate powder on some gauze and then hold that onto the part that is wounded. So the potassium permanganate stops the bleeding in a couple of seconds. And like I mentioned, the styptic liquid called Botroclot, or you also get styptic powders online, that can be used instead of potassium permanganate. So sometimes if you're trying to clip your cat's nails at home and you clip them a little too deep, they may bleed. So for something like that, you can take a little bit of the Botroclot on some gauze and hold it against it. The main thing is to keep them calm. So in a situation like this, I would also give them gabapentin just to calm them down, because if they're running around and getting more stressed, that's just going to make the bleeding more. So basically just got to apply pressure. If it is a wound on the tail wounds are a little harder because they keep swishing their tails and the blood will just go spraying. So with that, it's really important to give them the gabapentin first. And also maybe a good idea to keep them in their carrier just so that they can't move around too much, and then like bandage up the tail. But pressure is the main thing that you need.
Okay. So what are some of the common ailments to look out for in the first 1 year of a kitten?
In the first 1 year, you get a lot of tummy issues. So diarrhea and vomiting would be something to look out for. Like a one-off thing or one loose stool or one vomit would be fine. But if it is like, complete watery poop, that is something to be concerned with. And you'll have to do a stool test and of course take your cat to a vet. Because you get parasites like coccidia and other parasites that could cause really bad stomach infections. If your cat hasn't had the first vaccine and you bring them home from like a shelter or rescue or whatever, then you're also looking at parvo as one of the possible things that cats can catch, which is similar to dog parvo. So you will have like bloody diarrhea, sometimes bloody vomit as well. So we'll need like a lot of IV fluids, and parvo is really terrible. So you've got to be really quick and catch it quick and treat it fast. So those are your tummy issues. Another thing that you see with cats, especially Persian cats, is skin issues. So they'll come in with either mites. You'll see their ears are full of like this really crusty thing inside. So on your first visit to a vet, always ask them if they're not checking the ears on their own. Just make sure that they check the ears as well for mites. With Persians, more often than not, in 90% of cases, they will have ear mites. So that's.
I had a question about this.
Yeah.
I have noticed that white or ginger cats tend to have ear mites or gunk in their ear far more than black cats, tuxedo cats, or any other cats that I've seen. Is this something that you've also come across, or is it just my personal experience?
White cats, yeah, I think light colored cats, gingers as well. Yes, they do have more. They're more prone to mites or something.
Why? But it is so, right? It is true.
Yeah, I mean, it just happens.
Okay, good, great. Okay. I thought it's just me and I'm attracting all these mites to my cat. Okay. Yeah, you were saying.
So ear mites and otherwise the other kind of mites that can cause like scabies and stuff. So you'll find like crusty lesions on the face and the head. And the other skin issues that you can get is ringworm. So with ringworm, you'll have like actual circular lesions on the body here and there, and that will need oral antifungals and other stuff. So yeah, that's one of the stubborn things, stubborn infections that you can encounter in the first year. Apart from that, if you're really unlucky, if your cat's really unlucky, then you can have neurological issues as well. So you'll have some kittens who have seizures, you'll have some kittens who are pressing their head against the wall. So these are all things that you need to address quickly and do a PCR to check for like neurological diseases like toxoplasma and mycoplasma and things like that.
And worms is a big issue, right?
Worms
It's
are a
really,
yeah.
and is it something that happens more commonly in kittens as opposed to adult cats, or is it across ages?
You'll see the worms more in kittens, and the worms will affect kittens more than adult cats. Like adult cats can live with worms quite happily, it won't really affect them. But with kittens, I mean, that's why you'll be deworming your kitten regularly, like every 2 weeks till they're 3 months old, then once a month till they're 6 months old. And then after that, every 3 months or 6 months. But yeah, on the first visit to your vet with your kitten, you'll be deworming them. But sometimes before you deworm them itself, you'll be finding your kitten throwing up worms and passing along worms. So you'll have
I saw them come out of my kitten's butt, and it freaked me out, and they spilled on my carpet, and I was just stunned about what do I do with this, and they're really icky. And since then I've been very like specific about deworming very regularly, because I don't want to see white disgusting worms in my carpet, and I don't know where else, because the cat sleeps with me on my bed. Imagine that.
yeah, so worms is something that's pretty common as well. But only if your cat is unwell in other ways, will the worms really affect them really badly if they're older. Otherwise, if they're younger, deworming them regularly should take care. The other health issues that you can find in younger cats is respiratory issues. So, like congestion and things like that. So even with your basic viruses, most of them are accompanied with respiratory issues as well. So you have a lot of weepy eyes, crusty eyes, eye discharge, and you will also find them sneezing, snorting, some little yellow discharge coming out of the nose. All of this together would be your viral complex. But that's something that you should really rush your cat into the vet for. If you find them having difficulty breathing or wheezing, or just looking really uncomfortable and not sleeping comfortably, you'll be able to see that their breathing is a little more labored. That's something that can happen with younger cats or older cats. Yeah, so in the first year, I think these are the main things that you have to look out for.
Someone has asked, Doctor, can you explain about the FIV infection? Is it curable?
So unfortunately, no, FIV is not curable. FIV and FELV are two viruses that are normally carried from the mother's milk. The kittens are often born with them, but they can also be transmitted through a bite of a cat who's infected. So FIV is a lot like HIV in humans. So what it does, it just reduces the immunity of your cat considerably. But that doesn't mean that an FIV cat cannot live a normal life. Like they will live till 12 or 15 or whatever, quite easily. You have to look out for basic infections that other cats would get rarely. In an FIV positive cat, these will be very common. So you'll have to check their gums very regularly, because they're very prone to dental issues, and they're also prone to respiratory issues. So, the moment you find your FIV cat starting to have even a little bit of nasal discharge, take them to the vet so that they can start them on good antibiotics and nebulize them, etc. But yeah, gingivitis and respiratory issues are the two main things that you will find with FIV cats. And it's good to get your cat tested for FIV and FELV before they're spayed. You get these basic kits that all vets will keep, IDEX snap kits. So it's just because if they're positive once, they'll be positive for life. And if it's an indoor cat and they're negative once, they're most likely going to be negative for life, because they're not going to be bitten by an outdoor cat who has FIV.
So on that note, what is the frequency of visits to the vet that one must follow, and what is the basic standard checkup routine that you should ensure happens at every visit?
So you're going to have the most number of visits when your cat is under a year. So from kittenhood till 1 year of age. So you have to do around 4 visits for the deworming and then the 3 vaccines. So that will be every 3 weeks at a 3-week interval for your kitten for each vaccine. After that, you'll probably take your cat in for the neutering, spay or neutering. So for that, you'll have to get a blood test done first. So from 4 to 6 months is a good time to neuter them. So at that point, you'll be taking them once for the blood test and then the second time for the surgery. And after that, I mean, maybe when your cat is 8 months old, you can get 1 checkup done, but that isn't even really required. So for your first year, these are all the visits that you'll have to make. And after that, I think between 1 and 3, you don't really need to get a visit done at all.
1 to
Maybe
3
it's
months.
1 for the vaccine again. So when you're going for your vaccine at 1 year, 3 months, you get a full annual wellness check at that time. So, that would mean checking their ears, checking their temperature, checking their chest, of course, all of that. Yeah, that's it. I don't think you need to do a blood test between 1 and 3 years of age. And after that,
So-
once a year is a good.
Once in a year is a good enough.
Yeah. Yeah.
Unless there is some
Unless there
extreme
is some
emergency. Yeah.
like a kidney issue or a liver issue or something. And when they
Okay.
cross 12, then I'd say every 6 months.
So, what would be some very specific signs that you must go to the vet immediately?
So like I said, respiratory issues is something that you have to address immediately. So if you're finding your cat having any difficulty breathing or, just sitting down and keeping their eyes closed, like they're in a lot of discomfort, that's something to take your cat to the vet for immediately. If they've not eaten for more than a day, if they vomited more than thrice and it's not responding to on them, that's also something to take your cat to the vet immediately for, because they'll get dehydrated and you need to give them fluids. Any neurological issues, of course. If you find that your cat has eaten something that they shouldn't, like ingested a little bit of chocolate or, been around lilies, or someone has given them frozen by mistake, all these things are emergencies. So you've got to rush them in at once. Like with dogs, if they eat something that's toxic, you can make them throw up. With cats, it's not so easy. So you have to take them into the vet to get them throw up. But yeah, the main thing is to take your cat to the vet is if they're showing signs of dehydration. That's if they pass like 7 loose stools or vomited a lot and they're looking really dull. Or if they've not eaten for more than a day. Or even if you find that they have a really high fever, and if you've got Hempirin and you've given them 1 dose and it's not working, that's also another reason to take to the vet. A really big reason to take your cat to the vet, especially if they're a male, is if they're not peeing. So this is something that only males go through as an emergency, but they basically get blocked. So a blocked cat is a cat who's unable to pee. So you'll find them going to the litter box, spending a lot of time in there and coming, going in and coming, but not being able to pee. So that may need like surgical correction, or they'll definitely need to be sedated and have their bladder empty. So that's something that you can't say, oh, I'm working today, I'll go tomorrow. You have to take them in that same day.
Blood and poop could be another one, right?
Yeah,
Is
with
that
any
a big
diarrhea.
thing? Diarrhea.
Like if
Bloody
it's solid poop with a drop of blood on the top, that's okay. I wouldn't want to like
Is
crush
that
it.
okay?
That's okay. Yeah. So that can happen if they're having a reaction to certain foods, or if they've got like a little bit of an anal gland irritation or something called colitis. But that sometimes just with the probiotic it will settle.
Okay.
We have a question. Is there a medicine that can be given along with food for any outer injury or wound to a community cat who won't allow to touch her or him? An alternative to betadine, which can be given through their meals.
Even in the meals, so there are lots of antibiotic options that you can give to community cats. If it is a healthy cat and doesn't seem to have any other issues other than a wound, Barocin is a good idea. That's Bayrocin. So a Barocin 50 milligram tablet, you will give half a tablet to a big adult cat and a quarter tablet to a small cat. So this is just a once a day dose. You can do it once a day for 5 days, should be good enough. If you can administer meds to the cat twice a day, then there's nothing like amoxicillin and clavulanic. So that would be like an augmentin syrup, or you get a tablet called Toxomox. and the dose is 20 milligram per kg. I mean, it depends on the weight of the cat, basically. But augmentin is a good option. These are something.
Can you spell it out?
The spelling.
The Barocin or the augmentin? Barocin is Bayrocin. So Barocin 50, half a tablet for a big cat. CIN.
N. I am so bad at this.
Barocin. Yeah. No, there's no alternative to betadine, unfortunately, that you can put in the food. You'll have to clean the
Also, I
wound.
think a physical wound will require a physical treatment.
But using an antibiotic normally helps.
Okay.
And you have to make sure that there are no maggots. That's a big thing. So that's another thing. Maggot wounds is something that you may need first aid for stray cats. I think having a separate first aid kit for strays is a lot more stuff than for your home cats.
But the problem with strays is mostly that they don't allow you to touch them. And that is a barrier which is difficult to get over if you have to apply something on their skin.
Yeah. I mean, sometimes if you're the regular feeder, they shouldn't. It just depends. I mean, if they're distracted with some wet food or something, they should let you handle it. So I'm not sure whether I should say this or not, but ivermectin is something that you can use for maggot wounds. With stray dogs, you'll find people giving like Neomec, which is an ivermectin tablet, but you can't give the tablets to cats. So you get like an oral ivermectin liquid. So you can put 2 drops of that on a maggot wound if you can't take a stray cat to a vet on a particular day. And the next day, the maggots will always fall.
So why can't you say this? Is there an extreme reaction to it if not used correctly?
Sorry?
Is there a reaction, negative reaction to it if not used correctly?
Yes, it can cause blindness if you use it in the wrong.
So in very small doses, just 2 drops and not more.
And not oral is the main thing. Because people tend to mix all these things in the food. But for cats,
that's a big thing, yeah. So you can't mix it in the food on the food.
Yeah.
Ivermectin.
I do know a lot of feeders who will put ivermectin tablets in the food, but that's just, no, don't do that for cats.
Do not put in food.
Okay, so someone has asked about are water lilies equally dangerous as lilies? And what could be the reactions that they could see on their cat?
Water lilies are not as toxic as regular lilies, but all lilies are toxic. And the only thing that is toxic about the plant is the pollen. So it's not like the entire plant is. So when people get lilies home, like as flowers, if you cut off all the stamens and the pollen of the flowers, then you're fine. So it's just the pollen that is toxic. The signs that you will see, unfortunately, with lilies, the toxicity is so fast that, I mean, a lot of people talk about finding their cat, unfortunately, dead the next morning after they've had lilies out. So it's a very fast sort of reaction. If there are less lilies and your cat is large and they're not so close to the lilies, the signs you see, what it basically causes is kidney failure. So the signs of kidney failure is drinking a lot of water and peeing a lot. So you find your cat doing that, and also vomiting. Vomiting is another sign of kidney failure. So if you find your cat showing any of these signs, it's going to need a lot of IV fluids every day and stuff like that, and blood tests. But yeah, water lilies are not as toxic, but they are still toxic. So just avoid all lilies.
So I think that does bring to the end of the session in terms of questions. And are there anything else that you wish to ask?
No, that's it. Unless anyone else has anything else to ask on chat, we will be closing the session for question and answers.
No, I did. I checked the questions on that Excel sheet as well. So yeah.
Great. Do you want to give any basic advice for cat parents other than anything that we must have asked already?
One thing I'd say if you're going to take your cat to a vet is to not take down the cat carrier only when you're taking them to the vet, because then they're going to have very negative associations with it. So maybe keep one carrier down all the time and keep like a little bed in it and some toys and stuff. So they think of it as a happy place. And you can use some catnip. Catnip is a great thing to have around the house if you have cats. But using it especially when you're taking your cat to the vet is a good idea. I mean, you want your vet visit to be as stress-free as possible. Because with cats, compared to dogs, with cats, stress really affects them negatively. So you don't want to have an already sick cat very stressed when they're going to the vet. So you want to keep the whole encounter as stress-free as possible. So don't take your carrier down only when that's one thing that I do have.
That's
Yeah.
great advice.
So interesting to know that, sometimes we unknowingly, they just relate those few things just as a veterinarian visit. And then the minute you remove that and they know they're going to a vet and it's just a chaos in the house. So that's a good point to note. Yes.
Yeah, when I used to work in
Okay.
the clinic, very often you find people calling in and saying, "Oh, I can't make it for my appointment because I can't catch my cat." Like
Because they know what you're doing to them. They know where they're going.
Yeah.
and gabapentin, like I said, giving gabapentin before a vet visit is always.
Have you heard of Feliway? And is that something that's recommended to use to calm down cats?
Yeah, so I find Feliway quite useful. I've used it myself also.
On you, like as a human
No, I
being?
mean I've used it for my cats.
Oh,
not
okay.
myself. But yeah, Feliway I think works pretty well. So for fractious cats, for anxious cats. I
And
mean,
there is no side effect, is there?
no, there's no such.
Okay.
So you get it for single cat houses, you get a multi-cat Feliway, and they're plugins like you're all out of them.
And they're basically pheromones, right?
Yes.
That do they work on humans
No,
at all?
not worked on me yet. Oh, one thing that I
Okay.
forgot to mention with your frequently encountered diseases is anxiety. So anxiety, in fact, I'm hearing about more and more cats who have got anxiety. So
I think humans are transferring anxiety because all of us have
I
anxiety.
think that's quite possible.
I agree
Yeah.
to that one. But yeah.
But how does that show up in cats? How would you register?
So one of the main things you find is overgrooming. Overgrooming and also self-biting. So they'll bite their tails, they bite their paws, and the grooming is a big thing. So they'll lick themselves till they get bald patches or
Okay.
yeah. But with cats who have anxiety that's that bad, Feliway will probably not be enough. You'll need like other anti-anxiety meds as well.
Is there a cat therapist? Is there such a thing now?
We need cat
Can you-
behavior. This is the closest thing.
Okay, fine. Okay, great. So with that, I think we can end the session. Do you want to add anything more on the anxiety?
No, you did
I
not.
think even CBD oil as well would be a good idea for cats, especially for older cats.
Would you
Just-
recommend that? That's a good thing?
Yeah, I recommend.
CBD oil.
Yeah.
But how do you administer it?
Consume it or apply it.
You get pet specific ones. If you can't get the pet specific one, then a human one is also okay.
And this works on both humans and cats.
This works on both humans. If you get the pet specific one, then they're often bacon flavored and stuff. So I'm not sure how many people like that. So how do you administer it? Well, you can put like a drop on their paws, like on their wrist sort of thing. They'll normally lick it off. Also massaging it into their head a little bit works. And
I'm going to try that. Okay, great. I'm actually going to try that. I've never tried CBD oil. I've heard it's an upcoming product in the market, and it's all natural. So it's worth a shot, especially if you're recommending it.
Definitely.
How about just asking for relaxation? I mean, for dogs, I do generally use sometimes scents, but does it work for cats as well or not a good
Lavender
idea?
does help.
Sorry?
Lavender does help with anxious
Lavender.
cats. Yeah.
Okay.
So in a lot of like cat clinics, which are fear-free clinics, you'll have like lavender diffusers on as well.
But isn't it, I mean, from what I've read, lavender essential oil really annoys cats as a smell. Isn't it too intense for them or toxic for them?
If you're actually applying it on them, then yes. But as just a smell in the background, it has to be like a mild scent.
And the fragrance is not an irritant to them in that case?
No, I don't.
It's part of like litter or something like that.
A part of litter, I don't think you should use litters with fragrance anyway. But
Okay.
yeah, and the smell that you get from lavender cat litters, if you see, it's not really lavender. It's like a very artificial
Synthetic.
synthetic
Okay.
scent.
So what you mean is a diffuser giving out a lavender scent is okay,
Yeah.
but that being the scent or the fragrance being part of any kind of product like grooming product or litter is not something you
Yeah,
do.
nothing that comes in contact with the skin.
Okay. Got it.
But that brings
That's
me to
right.
the point why the flavored or the scented litter is not okay.
It often causes allergies. So you'll find that with cats with feline asthma and stuff like that, a common factor in all of them is that you'll have scented litter.
Okay.
And they're in such close contact with the litter, right? So you want to minimize the artificial stuff that's in it. So
They lick their paws after going into the
Yeah.
litter. It goes into their digestive system. Those are the issues, I suppose.
I mean, if you really want to get rid of the smell in your litter, you can use a little bit of baking soda in it, just like a tablespoon you can sprinkle on top of your litter. You have these things that they sell as litter deodorizing pellets or whatever. That's all just basically baking soda.
Oh, that's interesting. Yeah,
Very cool.
I'm
Great.
try and get back on that one. Done. So, Vinda, you haven't shared the fundraising link.
So yes, throughout this month, we are of course having a series of seminars. This is one of them, but we're also conducting a fundraiser on curiouscatcompany.com. Part of the proceeds go to QPA, which is a 32-year-old NGO in Bangalore that runs one of India's largest community cat sterilization programs. So a part of the revenues that we raise to this fundraiser will be going towards that program to sterilize community cats. I am putting the link in the chat. If you guys want to check it out, please do and shop, and it can help some cats get sterilized. That's it. That's all, folks.
Yes. I think pros. Yes, thank you so much for joining in. Thanks, doctor, for coming in and actually giving us so much information. I will compile the first aid which Vinda has written down and probably get the spellings checked from you. If it is perfect, then we'll put it out to people. Anything else, please, people feel free to message us or reach out to Michelle and she'll be happy to help. Thank you.
Thank you. Thanks.
Thank you, Dr. Michelle. Bye. Bye, guys.
Thanks.
Bye.